You are the first person to join the conference.
Yes, yes.
Yeah.
You are in the meeting
Okay,
now.
thank
Thank
you.
you,
So
sir.
I'm sharing. Stop sharing.
Yes, you need to immediately stop share after your presentation. Actually, thank you, Dr. Sam.
Do you mind if I share my screen next? Because I have to leave in a bit.
Okay, sure. Okay.
Thank you. Thank you. So can you see it?
Yeah. I think it's visible, but you need to
Yeah. So it's just there's no videos. It's just images. So I don't think there should be any problem.
Yes, slides are running well.
Yeah.
Is Professor around, or is he busy in the clinic today?
Yeah, he's busy in the clinic today.
Are you his son, who is a dentist?
No, I'm an ophthalmologist as well.
Oh, yeah, ophthalmologist as well. Okay,
Yeah.
good.
Yeah.
Okay.
So that's
It's
it.
running well. Yeah.
Yeah.
Thank you. Yes.
Thank you very much. Thank you.
Yeah. Thank you. Can I request Samili to show your presentation?
You have to explain to me how to screen share. I'm not very familiar.
Oh, you can sit down. There is a green button with the arrow on there. Can you see it here? That in your screen.
Yes.
So you need to first open your slide. Actually, you need to open your presentation PowerPoint. Then start sharing the screen. Yeah,
It
I think
says
excellent now. It's there.
It's very simple. I don't have any videos. And compared to other things, I'm just explaining about the situation in Maldives.
No worries. That's fine.
No worries. Comparing to other countries, the country is really very good. Lot of islands are there.
But our population is very small. It's about 500,000. So we have very few cases, and our expertise is much less than yours. So it's a very simple presentation. I have just 10 slides.
That's excellent, Samili. That's an excellent summary from Maldives. We'd love to hear you tomorrow. We need to join an hour earlier tomorrow, just to make sure that everything runs properly. And then our moderators may explain some of the things tomorrow before we start our webinar. Yeah, thank you, Samili. You can now stop sharing. You can hit the same button where you started. Yeah. There is stop sharing. Yes.
Yes.
Now, is any of the speaker left behind to show their presentation, or I think we're done with?
I think we are done now. Yes.
Professor Sandagruit is busy in some of the other meetings. That's what he called me just now, and then he'll join us tomorrow an hour earlier so that everything goes all right. And then
I think Professor Nazrul and Mahipal sir.
Mahipal sir, I think he's going to join us tomorrow because he's not here yet. But
Hello?
we'll ask them. We can wait them. I think we can wait them for another 15 or 20 minutes.
Sanjay sir, can you share again video
any PPT?
So shall I show my video again?
Yes, sir.
Okay, that's fine.
Just checking the audience link. Now audio is there.
Okay. No, but I don't have any audio thing over there. It is just
Audio
a
is
video.
not there. Now, okay, sir.
Audio.
You only check the video, na? Can
Yes,
you share
sir.
the?
Yes, it is here. Okay. So just wait a minute.
So it is already cold in Nepal,
Yes, it is. In Kathmandu, it's very cold now. Yeah.
but we are enjoying summer here.
No, it depends in Nepal also. If you go to the south, I think Sanjay sir will be able to say
Yeah,
the
it is
southern
quite,
part.
it is very, very nice weather here.
Yes.
So now again I'm showing my videos. So it is there.
So Dr. Namrata will be there in tomorrow.
Yes, she will be there. Actually, she was supposed to join us today, but I don't know what went wrong.
So I think the video is running, isn't it? Yes.
Yes,
Yes,
nice
it's running, sir.
time.
Yeah, there is no sound. Yes.
Great planning, Ben. You are a great organizer.
Thank you, Sam.
So again, you can see the videos, I think. There is no problem. So I think this video is also visible, isn't it?
Yes.
Okay, good. So that's fine.
Sir, I think all of your videos are playing there. It doesn't have sound, no, sir?
It doesn't have sound, yes.
Okay.
So there is no problem. Okay, Dr. Ben, then we will see you tomorrow.
Sure, sir. Thank you for coming
Okay.
us and joining us
Okay.
for the test. Thank you, sir.
Thank you, Dr. Ben. Sir. Namaskar.
No,
Bye, everybody.
Sunday, something new to look forward to. For
Yes, sure, sir.
Very new for me.
Sir, Boli, we will see each other.
We'll listen to you tomorrow. Yeah.
Sir. Thank
Okay.
you, sir.
Good work you are doing. Congratulations. Yeah. Quite a few representatives from Nepal. Ben, we done a good job, and all of them from the region. That's good.
Thank you, sir.
From the Shark country only. I know. That's good.
So, Malla sir, I think we have started
Yes,
with glaucoma.
yes,
We have started with glaucoma, no? So that was also a nice session, and now it is our second session. So I think it will be also very nice.
Webinar, yeah. And the
Yes,
third one will be on in retina probably, and Lalit is going to see to it.
yes. Lalit sir will be.
And there is cornea also for Namrata, I believe.
Yeah.
Everything going smoothly.
Yes.
And because of the COVID, maybe we'll have to make changes, but that's how it's going to be. And I think Ben has done a wonderful job. Don't you agree, Sam?
Yes, he must.
Yeah.
He's really very good organizer. I have already told.
Thank you, sir.
I didn't know that aspect of Ben, but he's done a wonderful job. I'm very much impressed. And I said, from Nepal, at least Ben has shown how Nepal can also perform these webinars. We are impressed with Bangladesh. I have watched Bangladesh, 1, 2, 3 of them. You are quite few people, so
Yes.
wonderful. Yeah.
Yes, sir.
Yeah, Oculoplasty and what others, yeah. And women ophthalmologists, I attended and
Yes.
really been participating. And above all, your lady is great.
Yes.
Ava. Yeah,
Yes.
okay. Anyway, give my regards to her. Anyway, I'll be seeing her tomorrow.
Sir, there is a news for you, sir. I have shifted to Dhaka, from Chittagong to Dhaka, and I have joined as an associate professor and head of the glaucoma in the Bangabandhu Sheikh Mujib Medical University. Now I am in the university, medical university, sir.
Congratulations. Yeah,
Sir.
you are dynamic and very active,
Yes, sir.
like our young doctor, like Ben, Wonderful, yeah. Very good. Congratulations.
Oh, thank you, sir.
Ben,
Yes, sir. Yes, sir.
I think I can take a leave. No, I better
Yes,
go
sir.
now.
Yes, sir. Okay. Thank you, sir. Thank you for joining us now, sir.
All the best to you. Yeah, I just wanted to see
Thank
how
you, sir.
you are conducting this meeting, and you've done a wonderful job. Yeah, you've done great.
Yes, sir.
Okay, all the best to you, Ben. All
Okay,
the best
sir.
to all of
Okay,
us.
sir.
For tomorrow.
Thank you, sir.
Okay, good night for now. Love,
Night,
Sam,
night.
you too. Bye.
Okay,
Good
sir.
night.
Thank
Okay,
you, sir.
Sam.
Take care, sir.
Good night.
Night, sir.
Thank you.
Samili, you look so different from the photo that you sent to us.
Really?
Yeah. In the photo, you look like more, more chubby. But now I can see you very slim and very beautiful. Okay.
Good.
Thank you.
Yeah. Okay.
So, Shamali, you are staying in the Mali?
Yes, I'm from Maldives. I live here. I work here as well.
Okay. How many? Is there any institute there? Ophthalmic postgraduate institute there?
No, I studied in BPKLC US and TUTH Nepal.
Okay.
Yeah, it's really done all our education in Nepal.
Yes.
That's good.
Great.
One of the merchants who studied in Malaysia, all the rest have studied in Nepal.
Yes.
Nepali representation.
So I think one of our SARC Academy of Ophthalmology conference can be in the Nepal within Eyelid. Because
Yes, that's what I'm expecting, Dr.
Yes.
Samili. In future, we should organize a conference in Mali.
Yes, we should. Once COVID is finished, I think we should organize one.
Yes, I have been talking with our Mohammed for many years about the conference in Mali, and he's also positive for that. But unfortunately, the COVID hit. Actually, otherwise we had a plan to do within these few months time in Mali. Maybe oculoplastic workshop or maybe training, hands-on training. That's what I was planning for. But unfortunately, COVID has hit our life very badly. Yeah. So I want to welcome Harsha Bans Lal sir. Sir, are you there? Bans Lal sir, are you there?
Dr. Eli is there. I think Dr.
Didi, namaste, welcome.
Welcome.
Didi, I cannot see you after long time. I don't see you. Didi, namaste.
Sit behind.
How are you? How are you now?
Yeah. Now I think I'm there now.
Yes, you are visible, Didi. Arbans sir is there? Arbans Lal sir, is he there? Or not? Because I'm sorry, we had a sudden change in the plan. Actually, Zepto and MyLook surgery was actually about to be covered by Dr. Lalit Verma as a panelist, but unfortunately he said that he doesn't do that surgery, and he has requested Arbans Lal sir to do a panel comment on Dr. Sanjay Singh presentation. So I'm sorry, Arbans sir, for the last minute trouble to you. We just sent you invitation just today, and then the webinar is tomorrow. I'm really sorry for that. Arbans sir, are you hearing us?
So Lalit sir will not be there tomorrow.
No, he will be joining us for tomorrow, definitely. But I think the comment part is he has left it over to Arbans Lal sir,
Okay,
so that
fine.
yeah. But he will be definitely there in the tomorrow webinar. He will join us as an organizer, but yeah, but he's not going to give his comment on the presentation tomorrow.
Yes.
Yeah. And Samili Jafar, your presentation is going to be a panel discussion by Dr. Irfan Jiba, who is from Pakistan, who is very active and dynamic cataract surgeon, and also oculoplasty. Actually, he has done some oculoplasty work in UK as well, apart from cataract. So I think he will be giving some comment on your presentation, and he said, "I've never been to Maldives. How can I do that?" And I said, "No problem. It's all about cataract." Actually, all want to go to Maldives. Everybody's excited to come to Maldives. So I think
I like to go to the Paradise Island.
you want to go to where? Island?
Yes, Paradise Island. This is very good.
Paradise Island. Okay, I didn't know about that.
That's the name of a resort.
Yes.
It's very expensive. No?
Okay. The family is there, so it should not be expensive for us. Family, I heard that one of the Nepali doctor is working there as an eye surgeon, cataract surgeon. Yes.
Yes.
One or two.
Right now, I think
One Bangladeshi too.
yes.
In the Maldives.
And we also have one, more than one Indian. So we have
One from India.
Yes.
Okay, so you have all SAC representative
Yes.
in Maldives. Okay, that's good.
Yes. We also have one Egyptian.
Oh wow. Do you have COVID or not?
We do. We have, but the numbers are going down right now. We had a peak about beginning of last month. So right
What
now,
is the infection rate now in Maldives? How many people are getting infected per day?
around 20 right now, between 20 and 30.
Oh, that's not bad.
It is bad for our population.
What is the population? Is said five.
And very interesting. We have today 30 deaths
30 deaths in one day.
in one day. Today.
Is it a low or high?
Our
Is it now low? But we had 50 per day.
Okay.
2 months back. Yes.
Okay.
50 deaths per day. Now it is 30, 35, 25.
That's good. Actually, it's going down. We're hoping that the COVID should go down, and then we should meet physically, and then we have more meetings physically, and then we meet each other. I already start to miss my colleagues, my Oculoplasty colleagues from all around the world. We have not been able to do any physical meeting.
Yes.
So yeah, it's a bad part by COVID to
So
us.
I think you are also associated with airports,
Yes.
Trauma Society.
Yes.
Airports. Yes.
Yes. Actually, I do a lot of preventive work in my country about the trauma.
Yes, I observed. You are doing a lot of
Yes.
camps and
Yes, I do camps, and apart from that, I do educational awareness program for prevention of ocular trauma. And I also give free glasses to the workers, factory workers, and also all agriculture workers, so that they prevent their eye trauma.
so still, Dr. Ben, you are in the Tilganga now. Yes.
Oh, I'm still in Tilganga, yes.
But apart from the Tilganga's works, you are doing some personal
Yes,
works.
right.
Really
I'm
very
doing from
Yes.
my personal.
So in the Tilganga, can you do personal practice there, or it is a non-practice?
Yeah, we can do a
hospital?
prior practice. We can do
Yes.
a prior practice after our office work.
Okay, and you can do some charity also. Okay,
Yes, we
that's
can do
very
our
good.
charity all the time when we want. Yeah.
Okay, Ben, I want to share one thing. What is the prevalence of congenital glaucoma in your country?
I'm not sure about that.
Is it very common or very
No,
uncommon?
it's not common. It's not common, Dr. Sams. According to our glaucoma colleague that we work, they hardly do 2 or 3 glaucoma surgery in fortnightly. So, yeah,
Okay,
that's not much, I think.
Okay.
And because being a biggest tertiary eye hospital of Nepal, we are performing 2 or 3 fortnightly surgery is not a big number of problem, I think. It's not a big problem.
Yes.
Because all the hospitals may not be doing congenital glaucoma surgery in Nepal as much as we do. So that means the number are not so bad.
Yes.
So what is your program in congenital glaucoma, actually?
Actually, I'm doing some workshop in Bangladesh, because in Bangladesh 2 or 3 surgeons are doing the congenital glaucoma surgery, and I'm one of them. I personally do some workshop with the help of Orbis International, and actually I'm trying to. And in Bangladesh, the incidence is more. You know, almost I have to do almost 1 or 2 surgeries per operation per week. So it is. I think it's a good number, and ultimately the patient in a very late stage. So even after surgery, it is very tough to manage. And so I started some awareness workshop in the villages, and also
That's great work. Yeah.
yes, I started. So for that, I have just asked you, what is the situation? Hi, Dr. Rajesh sir.
Guys, sir, welcome.
Hi.
We have already tested 4 of our presenters today,
Great.
and then all of them did very well. They now know how to do a screen share and how to screen share off. They know it, and I think that's one of the excellent part of the test webinar, I think.
Great.
Most of the time I have seen in the webinar, our presenter doesn't stuck in where to click the button for sharing the screen and how to stop
Sometimes.
sharing, you know.
Yeah.
Sir, sometimes it is very common in the very senior doctors.
Yes, I
Yeah.
agree.
Yeah.
Yes, because you are there, Professor Rajesh.
Yeah.
One of our trauma webinar.
Yeah.
That was the problem for the 2 senior doctors.
Yeah,
And then the
actually,
rest of the 2
once, if you remember, last time when we were having this glaucoma
Yes.
webinar under SAO,
Same
the
here.
doctor from Sri Lanka, she had actually joined from her
Mobile phone.
file, I think. And then her presentation was in her laptop or maybe computer, desktop. And then she told that, yes, I have joined. So I asked her to share. So she told, okay, I'll share. I'm sharing. But how will I share? My presentation is not here in the mobile. So there is some confusion in the minds, actually. So it's always good to have a test,
Yes, sir.
some sort of a checking and testing for sharing the PPT.
And also 2 senior professors from Pakistan, they could
Yeah.
not share. So ultimately
Actually,
they have to.
Last time it had become really difficult, and I had to ask my IT person to constantly, I send them the contact details to contact them by WhatsApp call and take the presentation so that can be shared on time. So after the first presenter's glitch, after that we sorted it out because we could get the presentation PPT from the speaker. So I was after the life of my IT guy that you have to keep talking, keep calling and get the next presenter slide, you share from here. So that's how we could manage. So it's then only I had thought that actually, after doing many webinars, many times what happens that you tend to forget that, it's there, share, the share button is there, so you can easily share. So you don't realize sometimes that people can have difficulty. So it's always good to have a sort of a rehearsal.
Yes, that's
Yes, sir.
perfect. And I think tomorrow's plan is very good. You will start at 3 p.m. and it will continue as a
Yeah,
webinar.
1 hour before the
It's a
actual
really
live
good time.
webinar. Yeah.
Hmm.
And then the rest of the 2 presenter, Professor Mahipal Sachidev, probably he'll join us tomorrow.
Yeah.
And
He
Professor-
he's
and
useful, no? So
Yes, and Professor Nazrul from Bangladesh.
Yeah.
Actually, he said he may join us, but I didn't see him till now. I'm not sure whether because he said that he will be busy today, but he'll for sure join us an hour early tomorrow. So I said him that even if he can join us tomorrow an hour early, that should not be a problem. He may not
Yes.
join us today. That's what I
Actually,
said. to him.
last time I had requested to join 1 hour before, But
Yeah.
what happens that people join about 30 minutes, 45 minutes before, then they start, gossiping.
Problems.
And how are you?
How
is
to manage,
China?
how to
is
do,
COVID?
yeah.
How to do? What about the COVID situation?
What
here
is
in,
COVID situation there, and how is
Yes.
everything? So then what happens that they don't check their presentation, they don't check how to share it. So then it creates problems. But it's good that you did this a day before, so that people are used to. I mean, most of them must have presented, but it's always better to have
I think before.
and if somebody is very sure that he can do it, then he may join tomorrow. Like Dr. Maipal knows that he can do it, so he will join tomorrow.
Yes.
So can I share one of my plan, Dr. Ben and Professor Rajesh?
Yeah.
Yes. Actually, now I am in the Bangabandhu Sheikh Mujib Medical University.
Yeah.
I have just shifted my job here in Dhaka as an associate professor now, and head of the glaucoma here. And I am planning to, because I have organized a lot of webinars from Bangladesh.
Yeah.
And now from the December, I am planning to start some webinar between two institutions, like two famous institutions, like in the Bangabandhu Sheikh Mujib Medical University is only medical university which controls all the post graduations in the country. So from Bangabandhu Sheikh Mujib Medical University Ophthalmology Department and All India Institute of Medical Science Ophthalmology. So joint collaborative webinar that. And then BSMMU with Tilganga, a joint collaboration webinar. So I am planning to do it. What is the thinking?
Yeah, it's
Will
wonderful.
it be good? And even with the residents and some
Absolutely.
residents will present and also some faculty will present just to make a good collaboration between two institutions.
Yeah.
Yes.
Yeah.
We can
have maybe basic topics.
Yes,
so
yes,
that the postgraduate students will get the maximum benefit.
Perfect.
We can have basic topics so
Yes.
that they get the maximum benefit.
Perfect. Oh, thank you. Thank you so much.
That is a nice idea. Yeah. No
I
one is very
agree with
active.
Professor Rajesh. Yeah, that's a great idea to do that.
Yeah.
So tomorrow, there's little change in the plan.
Mhm.
Professor Lalit Verma sir will not be able to comment on Zepto and MyLoop surgery.
Yeah.
So I think Dr. Eli is going to call upon Dr. Harbans Lal, who is going to represent or not going to replace Lalit Verma sir tomorrow, but definitely Lalit Verma sir will be there as organizer.
Yeah.
But Harbans Lal sir will be giving his
One of the panelists.
panelists. I'm going to send him right now the presentation of Dr. Sanjay Singh so that he can review the presentation and then he can give his input tomorrow.
Yeah. That will be wonderful.
Yes, that's what the change has been made. And Dr. Eli, I think she is going to be a moderator during that session, and then she should be aware of that change, and then call upon Harbans Lal sir. I think I'll definitely ask Harbans Lal sir a short CV and his photo so that we can prepare a slide. For him. Yes.
Yeah.
I think that should be done. I'll do that immediately right after this test webinar.
Yeah.
So that I think everything is set. Nazrul sir will not be able to, I think, join us today.
Doesn't matter. We can do it. Maybe once he joins you tomorrow, you can ask him to share first, so that there's no.
Yes, I think that's the thing that we want to do tomorrow in the morning. I mean, not in the morning, in the afternoon at 3.
Whenever he joins, we will ask him to share.
First of all, we'll do that, and then we can talk about COVID later.
Yes. No COVID tomorrow.
Yes, I agree with that.
A lot of presentations tomorrow, and we have to recheck again.
Yes.
Yeah, and we have to. Yes, we will try to ensure that the speakers finish on time. So that's what. And Dr. Ben has assigned some work to us.
Sorry, sir, for trouble.
So we will be, particular about the presentations, that once they reach 9 minutes, we will have to send a signal to them that it's
warning signal, sir. 1 minute left.
Warning signal.
Yes.
So this is with your voice. This is with your voice only? The 1 minute more? You have 1 minute more?
Yeah,
Like that?
that's what.
Yes.
Yes, I did it. Sometimes I did it, but some seniors doesn't like it.
Yeah,
I know.
That's true. That's true.
Okay, so can I? I have one question to Professor Rajesh. What about the AIOS? Will it be virtual or?
We are just trying to see that we can do some physical part, and we can extend the date to June. And I mean, for that only, we are going to have a special GBM on Sunday.
Okay, fine.
So Sunday evening, we'll be able to know from the GBM. So after that, maybe by 7:30, we'll be able to know whether, what's going to happen.
Okay.
So
thank you. So can I leave because I have another meeting? Yes.
Yeah, sure. Thank you, Dr. Sams, for your presence.
Thank you, Ben.
Waiting to hear from you tomorrow.
Okay.
Yeah.
Thank you. Hi, thank you, Dr. Shamali. Professor Rajesh.
Okay.
Thank you for joining.
Okay. Bye. Bye, Dr. Ben.
Sir, I think Professor Rajesh sir, we need to talk a little bit. Maybe I think Shamali, if you have your work now, you're okay with your presentation. We appreciate that you came today and then check your presentation. And I'm sure that now by tomorrow you will be able to do your screen share and then also put off your screen share after you stop sharing your screen tomorrow. But again, we'll try tomorrow. Maybe first, as Professor Rajesh said, we'll do with the one who has not done today. Like 3 people has not done today. So we'll do first with them, and then you can also again try Shamali. And then I'm so proud that you are going to present the situation in Maldives very proudly, so that everybody now knows what is the situation around us, and we are all able to know where we are standing.
Otherwise, Dr. Shamali, how is it in Maldives?
We have a small population, so as I was saying also, it is difficult for us to get experience. Graduate and come back, the hands-on training is not so much, and we work alone most of the time. There is no retinal specialist, no corneal specialist. So as a general ophthalmologist, with the number of patients we have, it is difficult to get experienced. That is one of our biggest challenges.
We are ready to help you anytime when you need a help. Okay, we'll come there. We can give you hands-on. That's not be a problem. We can plan in the future.
We can definitely have something there also. It's a wonderful place to visit also, Maldives.
Yes.
We should
Actually, for Oculoplasty, we have already planned with Mohammed Azam, and then he was very much interested, and then I was also interested to come over Maldives and then do some work, give some hands-on training to the doctors who are working there. But unfortunately, COVID has hit our plan very badly.
Maybe a year later, we will be in a position to do that.
Yes, sir. I think so.
Yes.
By next year end.
Family, if you want to leave the meeting, you can leave it for now. And then please join us tomorrow an hour earlier so that everything runs well.
Okay. Good night.
Thank you.
Okay, bye. Good night.
Good night.
Thank you very much, Dr. Shamali.
Bye. Good night.
Eli Didi, are you there? Can you unmute your mic? Dr. Eli?
I think she has left.
No, I just called her.
But probably she is not there on her on the table where the laptop is.
Yeah, most of the people do that. They just keep on.
I guess she. Okay, it's difficult to say with what she has joined.
She's there.
You wanted to discuss something?
Yeah, I think we want to do a brief discussion before we wrap up now, because we don't want any problem tomorrow. So there will be a group of people tomorrow by 1 hour earlier, so we don't want to discuss at that time.
Yeah.
Just we want to reset our mind what we are going to do tomorrow. So
I guess she's not there. So
Yeah, I'm just calling her in our phone so that she can join us.
okay. Okay.
So tomorrow, actually, she's not picking up the call as well.
Okay. Maybe she is busy in something. So what we can do is that what we had planned was this, that I will start this, and then I will just introduce the organizers. So you want me to include Dr. Lalit Verma also as one of the organizers?
Yes, I think let's keep him as well, because I think he's also in the SAO, executive committee.
Yeah. So
I think he should be there.
We will keep him as an organizer. So
Yeah.
I will introduce about the organizers, very brief, and then I'll
also the SAO. You can talk about SAO webinar.
SAO webinar and the organizers. Then
yes, I think.
And what is our aim and how we continue, and this is a wonderful initiative, things like that. And then that these are the ones who are behind all this. We have Professor Allah, the president of SAO. We have Professor Ajwardhan Azad, the general secretary, and Dr. Ava Hussain and all that. And then I'll say that I hand over the proceedings to Dr. Eli.
Right.
We'll continue from there. She will invite Dr. Malla to speak a few words.
Yes.
And then she will invite Dr. Azad to speak a few words. And then
show a video.
Yeah, then the video.
Yes.
Okay. And then after that, she will ask me but then she has to after that she will ask me to introduce the first three panelists. So two panelists,
I guess.
No, she will introduce the first two panelists actually.
Yeah, she should do the
first two panelists, and then she will ask me to introduce the next two panelists, and then the first speaker.
Yeah.
And then the second speaker, and then the third speaker, and then after that she will take over.
Right. You have to carry on with the first session. That's
yeah.
And then she'll carry on the second session, and also the orator as well.
Yeah.
She'll handle the orator, and then that is all about the scientific session.
Yeah.
Then that is all done, and then she will ask me.
You will start the panel discussion.
Right. And then after finishing the panel discussion, again, she'll call upon Dr. Professor Ava Hussain.
Yeah.
And then I will just give.
And then after that, I will thank you and call you to thank everyone.
Yes. So do you need my small introductory slide?
Yes, I
can provide you that.
Yeah, please send it.
What about Harban Salal sir? Do you have his CV?
I will talk to him. I will get it from him.
Oh, okay, then that's fine. Because we need to get that, and then Dr. Eli needs that maybe a one slide.
I can see Dr. Harban Salal is there.
Yeah, but I can't hear him.
Okay.
There may be some connection problem, I think. Yes, he doesn't have mic on here.
I'll speak to him.
I think he has some problem with his connection.
Okay.
We need to actually apologize for urgent replacement of panelist for him. It's so bad that we have to request him at last minute to do a panelist to be a panelist.
It doesn't matter. He will not feel bad about it, I'm sure.
चुडामिनजी तपाईहरु हुनुहुन्छ?
हजुर सर
ओके धन्यवाद तपाईहरु यही हुनुहुन्छ है धन्यवाद है
हजुर
हाम्रो तीनजना स्पिकरहरुको चेक भएको छैन विल डु इट टुमारो
हजुर आज ऑडियंस लिंक पनि हामीले चेक गर्यौं एकदम स्मूथ भइरहेको छ सर स्मूथली इन ऑडियंस लिंक एज वेल
that's excellent news. And what about the number of registration till now? What is the current status?
237 we registered in Nepal only, sir.
70.
Up to today's afternoon.
270 you said?
237.
37, okay. That's good. Can you
Yeah.
just send me the? Can you just send me the list of the registration so that I can check and ask other people to join us?
Sir,
Yes, sure, sir. I will send it to you.
सर बात लाइन
WhatsApp number or
और एक फोटोग्राफ चाहिए.
Okay,
Do
sir.
we have the international registration as well?
I think
Yes, sir.
help you, sir.
अच्छा Saturday Sunday
Yes, sir. We have all the list, sir. I will just send you in the WhatsApp right away, sir.
Thank you, sir. But how many international registration? It's less than 100 or what?
आज अभी
I will just check, sir. Latest data, I will just check.
आज
Okay, thank you.
अच्छा मुश्किल है. नहीं कोई आने वाला है.
El Didi, are you here?
अच्छा. मेल कर दो सर. ठीक 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 ठीक. फोटो चाहिए होगा ना सर. चलो ठीक है. अच्छा वो एक्चुअली डॉक्टर बेन लिम्बू को भेजना है ना. ही विल प्रेजेंट. हाँ अच्छा नहीं आपका कोई फोटो वो भेज दो और बाकी चीजें तो निकल जाएंगी. बाकी कोई फोटो आप. हाँ हाँ ठीक है. डाउनलोडेबल है वो. अच्छा अच्छा ओके ओके ठीक है. Yeah, Dr. Ben, actually, I'm talking to Dr. Harbanslal and he's telling that he has a website, drharbanslal.com. So information is available there. ठीक है मैं निकाल लूंगा. इन केस अगर कोई प्रॉब्लम होती है तो मैं बताऊंगा. अच्छा ठीक है सर. और मैं देख लेता हूँ अगर प्रॉब्लम होगी तो मैं बता दूंगा. ठीक है ठीक 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 है. Okay, he will. He was just telling that if you can get it from that website he has just created actually recently.
Yeah, is he the one? Because I'm not much.
Yeah.
So, yeah, I think everything is here. We can just see.
Yeah.
We can put a. We can put a. We can put a slide on him.
Yeah.
Yeah, I think that's fantastic. I'll do this for Dr. Eli, and then I'll just send her.
Yeah.
So that it will be easy for her because this is last minute change, and then I think probably it's hard for everyone to catch the changes at last minute.
Yeah.
I'll help her to do that. Dr. Eli is not here now, I think. Is she here?
No, I don't think she's here.
She has left. I think she
She's
has
busy
left.
in something, so it doesn't matter.
Yeah. So shall we wrap up for today and then see each other tomorrow in the morning, tomorrow in the afternoon?
Yeah.
At 3 p.m. Nepal time.
And 3:45 is India time, right?
Yes, sir. And then I think Professor Namrata, Professor Rajbada Azad sir will be able to join us tomorrow.
Yeah.
At time, maybe I'll just send a reminder mail so that people will join us tomorrow an hour earlier. At least organizers should join us an hour earlier so that everything is set perfectly before we go to live webinar. I think that should be a good idea to proceed for our webinar tomorrow. Yeah.
Okay.
Anything I need to do, sir?
Nothing. Everything you have done already.
Yes, thanks. Thank you. So, okay, thank you, sir. Good night.
Okay.
And thank you for your presence, sir. Thank you. Thank you. Chudamini ji.
हजुर सर
सजनाजी हजुर
246 जनाले भएको छ टोटल अहिलेसम्म
हजुर
म कन्ट्रीको डिटेल पनि चेक गरिरहेको छु सर म एकैछिनमा हजुरलाई WhatsApp मा पठाइदिन्छु सर
मलाई पठाइदिनु न ल त्यो लिस्ट किनभने मलाई 2 जना हाम्रो पुरानो सरहरूले सोधिरहेको छ क्या मेरो रेजिस्ट्रेसन भयो भएन भने गर्दैन बाबु भनेर मलाई यहाँ मेसेज गरिरहेको छ त्यही भएर म हेर्न चाहन्छु त्यहाँ को छ भनेर उनीहरूको छ भने त किन डबल गर्नु रेजिस्ट्रेसन तर उनीहरू छैन भने मैले गरिदिनुपर्छ कि फेरि ल थ्याङ्क यू भेरी मच चुडामणिजी है तपाईँहरूलाई पनि लास्ट मिनटमा मैले दुःख दिँदैछु अनि धन्यवाद
अनि त्यसो के छैन सर थ्याङ्क यू सो मच डाक्टर साहब हजुरले हामीलाई चाहिँ अपर्च्युनिटी दिनुभएको हो यो
होइन त्यसो भनिदिनु हो म एकदमै खुसी छु है नभए मैले तपाईँहरूलाई एकदमै भारी बोझ बोकाइरहेको जस्तो फिल भइरहेको थियो सदाजीले त्यसो भन्दाखेरि कता कता मलाई चाहिँ ढुक्क भइरहेको छ मन है
ठिक छ नि सर हजुरले हामीलाई यो गर्न सक्ने भएको छ यो त राम्रै हाम्रो लागि अपर्च्युनिटी नै हो त्यो प्लेटफर्म
होइन
सरहरूले
धन्यवाद तपाईँहरूलाई है हामी हाम्रो तर्फबाट तपाईँहरूको लागि गर्नुपर्ने कोसिस पनि गर्नेछौँ र भोलि पनि म तपाईँहरू धन्यवाद दिन बाँकी नै छ है अझै पनि
सर हुन्छ नि सर भोलि एकदम होस् अब त्यही हामीले त्यही उयस गरेर आज जे होस् राम्रो भएको छ सर अडियन्स लिङ्कमा पनि राम्रो भएको थियो
राम्रो चलिरहेको छ नि है सिस्टमहरू सबै हाम्रो
चलिरहेको छ
क्वेसन एन्सरको लागि तपाईँले मलाई एउटा लिङ्क
पनि पठाएको छु अडियन्स भ्यूबाट
ओके तपाईँले नि जस्तै सजनाजी मलाई एउटा त्यो के अरे यो हाम्रो क्वेसन एन्सरको लिङ्क पठाउनु भएको छ नि त्यो क्वेसन एन्सरको लिङ्क मैले छुट्टै खोल्नुपर्छ हो भोलि फेरि त्यो हेर्नको लागि क्वेसनहरू त्यो पनि क्लिक गरेर अनि त्यो क्लिक गरेपछि कहाँ आउँछ त्यो क्वेसन एन्सर मेरैमा आउँछ चाहिँ
हजुरकोमै आउँछ डाक्टर साहब
मेसेज आइरहन्छ अस्ति पनि मैले बिर्सेँ क्या अस्ति गरेको थिएँ मैले बिर्सेँ अब अहिले
हजुर त्यो हजुरले एउटा लिङ्क क्लिक गर्नुभयो एउटा चाहिँ हजुरको स्पिकरको पेज खोलिहाल्छ डाक्टर साहब अनि Q&A को लिङ्क क्लिक गरेपछि त्यो अर्को ट्याबमा खुल्न जान्छ त्यही
भनेपछि दुईटा ट्याब हुन्छ मैले त्यो इन्टरचेन्ज गरेर हेर्न मिल्यो
हजुर मिल्छ डाक्टर साहब एउटा हजुरले Q&A को चाहिँ मोबाइलमा खोल्नु भए पनि हुन्छ
त्यो पनि हो आइडिया राम्रो अनि हामीले नि भोलि हाम्रो स्पिकरहरूलाई हामीले भन्नुपर्ने छुट्याउन नहुने कुरो केही छ
सबै एकदम राम्रो भइरहेको छ त्यो स्पेसिफिक त कुनै पनि छैन डाक्टर साहब
हाम्रो कृष्णजी
एउटा रिक्वेस्ट डाक्टर साहब हजुर डाक्टर साहब लास्ट टाइम चाहिँ हाम्रो जो बाहिरको कन्ट्रीको स्पिकर्सहरू हुनुहुन्थ्यो उहाँहरूले चाहिँ स्पिकर्सकै लिङ्क सेयर गर्नु भएको रहेछ कि आफ्नो साथीहरूलाई अनि उहाँहरू बाहिरबाट सबैजनाले हजुर त्यो स्पिकरकै लिङ्कमा चाहिँ सबैले जोइन गर्दाखेरि थियो अनि माइक अनको कारणले गर्दाखेरि डिस्टर्बेन्स भएको थियो उहाँहरूले चाहिँ अडियन्स लिङ्क चाहिँ सेयर गर्नको लागि रिक्वेस्ट गरिदिनुहोस् न
स्पिकरमा नेपाली डाक्टर सन्दुक रोहित हो एउटा नेपालको उसले त कसैलाई पनि सेयर गर्दैन उसको लिङ्क सो अर्को प्रोफेसर सञ्जय सिंह हो उहाँले पनि गर्नुहुन्न त्यो पहिला चाहिँ हाम्रो जुनियर डाक्टर साहबहरू थियो सायद मेबी उनीहरूले उसको साथीहरूलाई दियो होला क्या
उहाँहरू चाहिँ यसो बाहिर आउटसाइड नेपालबाट हुनुहुन्थ्यो त्यसले मात्रै भिडियोहरू अन अनि त्यसपछि माइक पनि अन भएको थियो त्यही भएर
म त्यो मेक स्योर गर्छु कि उनीहरूले अर्कोतिर लिङ्कहरू सेयर नगरोस् भनेर होइन हाम्रो स्पिकरको चाहिँ हजुर धन्यवाद सजनाजी म त्यो मेक स्योर गर्नको लागि उनीहरूलाई फेरि म मेलमा त्यो पनि लेखिदिन्छु एउटा कुरा थपिदिन्छु म भोलिको रिमाइन्डर पठाउँदैछु उहाँहरूलाई अहिले अनि रिमाइन्डरमा लेखिदिउँला त्यो पनि तपाईँहरूको यो लिङ्क चाहिँ अरूलाई सेयर नगर्नु भनेर होइन कृष्णजी इज देयर कृष्ण इज फ्रम इन्डिया नो he is from India. Krishnaji, last time we had a lot of trouble, and then we have to call you several times in between the presentation. Sometimes some of our speakers could not able to share their screen, or sometimes sound could not be heard. I hope this time there should not be any issue like that. Okay. Because I think Sajana has said me that last time some of the speakers have shared their speaker link to the audience as well, and that was a problem because of those issue. And I'm trying to send a reminder mail to all the speakers And I'll add on that, I'll make sure that they should not share the speaker link to anyone.
Okay, no issue. Tomorrow we'll connect to for 1 hour.
1 hour earlier, sir, tomorrow.
1 hour, 3:15 Indian time we will connect it.
Yes. Even a few minutes before is better.
Okay, no issue.
Yes. Thank you very much, Krishna ji, Churamani ji, Sadhana ji, and we'll meet tomorrow. Huncha?
Yes, sure, sir. Yes.
Awesome.
Thank you very much.
Yeah, welcome, sir. Good night, sir.
Good night. Thank you.
Sir, best wishes for tomorrow, sir.
Thank you, Sadhana ji. Thank you. Good night.